Welcome to this walkthrough of Jubilee journey inside Power HMS. We'll follow a full cycle from registration to consultations to investigations, all the way to dispensing and final play generation. We're starting from the main dashboard and going into the reception terminal. Here, we search for the patient and open their visit using their card number. The system confirms coverage details and benefit limits. We then select the doctor that the patient has chosen for her visit, and then select which services will come provided from this. The patient is now successfully registered and appears in the doctor's waiting list. We start from the main dashboard and open the nurse terminal. Here, we can see patients who have already checked in at reception. We select the patient and open their active visit. Inside the visit, we go to the vitals section, the nurse records, temperature, weight, etc. We then click to verify to make sure the data we have inputted is correct. Once everything is complete, the nurse updates the visit status and patient gets their coupon. Now we are in the doctor terminal. Inside doctor terminal, we pick out a patient from the queue and open it. Once the visit has been opened, the doctor can start recording things such as patient's history, pre-existing illness, any allergies, and etc. He then proceeds to write down the claim notes about the patient, followed by the management plan set for patient. Lastly, doctor writes the known diagnosis. After recording, the doctor then proceeds to write provisional code and prescribe tests for the patient. We then check to verify if the tests prescribed are in Jubilee or not. After we're done, we click Save Assessment and close. Now we switch to the lab terminal. We start by entering the login details. The lab dashboard displays pending orders. The technician opens the patient's request and reviews the ordered tests. In the sample management section, the technician confirms test requirements, collects the sample, after collecting sample, results are entered into the system. The technician reviews the values, adds comments if needed, and submits the results. We're back to the doctor's terminal. After we log in the credentials, it brings us over to this page where the doctor has written comments about the patients, and then we scroll down to where we need to prescribe medicine so the doctor can enter what medication the patient needs. In this case, the doctor is prescribing Melanil for this patient, as well as inputting how much the patient is supposed to have, for how many days, and etc. We then make sure if the medicines that the doctor has written is under Jubilee or not. once it is authorized. We scroll until the end of this page. We go ahead and click Update Assessment and close it, and then we are done. Now we move to the pharmacy terminal. The pharmacist opens the patient's prescription. The system shows all medications ordered during the consultation along with Jubilee coverage details. The pharmacist reviews the drugs, checks available stock, and confirms the quantities to dispense. Once the medications are issued, they are marked as dispensed in the system. All dispensed items are automatically posted to billing and included in the Jubilee claim. We're now at the back office, as at the end of every visit, we move to the billing section where all services provided are automatically compiled. We click on our patient's file while the system separates covered services under Jubilee and highlights any non-covered items or co-payments. We review the final bill, confirm insurance details, and complete the checkout process. Required insurance forms are confirmed and signed before finalizing the visit. Once finalized, the visit is closed and the Jubilee claim folio is generated and ready for submission. And that completes the full Jubilee workflow of Power HMS.